A controversial dietary twist. RFK Jr.'s saturated fat recommendation. In a move that has sent shockwaves through the health community, Robert F. Kennedy Jr., the Health and Human Services Secretary, is set to advocate for an increase in saturated fat consumption among Americans. This proposal contradicts long-standing dietary advice and has experts concerned. Cheryl Anderson, an American Heart Association board member and professor at the University of California, San Diego, shared her initial reaction. Let's see what happens. There was no indication as to how or why this shift would occur. But here's where it gets controversial. Kennedy's guidance seems to go against the grain of decades-old dietary recommendations. The recommendation to limit saturated fats has been a cornerstone of nutritional advice since the very first dietary guidelines. Ronald Krauss, a professor of pediatrics and medicine at the University of California, San Francisco, who has extensively studied saturated fats, offers an intriguing perspective. While his research suggests that saturated fats may not be as harmful as once believed, he cautions against Kennedy's potential message to eat more of them. Kennedy's plan, as reported by The Hill, indicates a shift towards promoting saturated fats from dairy, good meat, and fresh vegetables in schools. This has sparked debate among experts. Krauss's research highlights the complexity of saturated fats. He explains that they are relatively neutral compared to past beliefs. However, he emphasizes the importance of replacing saturated fats with the right alternatives, such as unsaturated fats like olive oil, to improve metabolic health and reduce heart disease risk. Anderson adds that while focusing on foods rather than individual nutrients is important, the current American diet already contains excessive saturated fats, leading to adverse health impacts. So, what's the real issue here? Nutrition science is a complex field, and ethical considerations make clinical trials challenging. Krauss points out the impracticality of asking people to consume high levels of saturated fats for extended periods to study their impact on heart health. Nutritional guidelines are typically developed over years, with rigorous reviews of the latest research. Anderson notes that it's unusual for the HHS secretary to make such a significant change overnight. The latest dietary guidelines for Americans report, expected to guide recommendations from 2025 to 2030, has yet to be released, raising questions about the current administration's approach. Krauss believes the report is being overruled and expresses uncertainty about Kennedy's final recommendation. He highlights the potential impact on school lunches and military rations, where an increase in saturated fat levels could have adverse effects on cholesterol and heart disease risk. The recommended percentage of saturated fat in both school lunches and military rations is currently less than or equal to 10% of total calories. Kennedy's proposed changes could significantly alter these standards. And this is the part most people miss. Krauss suggests that Kennedy's approach is selective, mixing responsible recommendations with evidence-based claims that may not be entirely accurate. What do you think? Is Kennedy's proposal a step in the right direction, or a dangerous deviation from established dietary wisdom? Share your thoughts in the comments.